know what to do, it's alright. It's good for me and you, it's alright. You know what to do, it's alright. It's good for me and you, it's alright.
Oh yeah.
Take me to the center.
It's good for a brother.
Take me to the center.
Child cries, disturbs the gods. The gods want the child to be silent. The gods need a peaceful path.
Is he in? Can I see him?
Jaja, the man of the other time is back. He's short but not short. He's tall but not tall. I bring him.
Yes, bring him. Bring him. You, go there. You stay there. Child cries, you disturb the gods. You stay there, you be quiet.
Remove your shoes. Remove the watch. Make sure your belt is not seen. You know Jaja doesn't want to see shiny things. They disturb the gods.
Jaja. It's me, Jaja.
It's you again.
Yes, Jaja.
I can see worry on you. But don't worry. With this Jaja, nothing remains the same.
Thank you, Jaja.
You are how now?
Nothing has happened yet.
This wife of yours, she's helping, she's not helping.
She's trying her best, but...
A sign that things are going to be all right. Hey, leave! Go! You see them?
Yes, Jaja.
You see these people?
Yes, Jaja.
They give nothing to the gods and expect the gods to be happy. Help me!
What did I do, Jaja?
Man, but when I'm there, all the gods will kill you and then kill me. Thank you, God. Thank you. Thank you. You see this one? This one is the grandfather of this one, the grandfather of this one.
Yes, Jaja.
This one slept with the wife of this one, and they cut off his head. You come from the line of blood of this one. Kayumba kajja nsomba bagenyi bano bagenda bano bayingira kayumba kajja nsomba bagenyi bano bagenda bano bayingira kayumba kajja nsomba bagenyi bano bagenda bano bayingira kayumba kajja every day nsomba bagenyi bano bagenda bano bayingira before the sun goes down bano bayinda bano bayingira dance 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 dance.
Help me, please. My child. Help. What am I going to do? You see my child.
I think your child has got measles. Take it quickly to health center and better hurry before they close.
But how? How do I go? It's far. I can't walk all the way there. Oh, my baby.
No border here. You come. I'll take you.
Thank you. Thank you, praise. May God bless you.
Do not be too heavy.
Good evening, Hope. How is handling the reception today?
Good evening, Dr. Sophia. Everything is fine. And thank you.
Oh, no, you don't have to thank me. You're the best person for the job. Things seem to be moving much more smoothly, and the patients are hardly complaining. Are those the records?
Yes, these are for the adult patients. These are for the child patients. And these ones are for the newly born babies and those under the age of 5.
Well done, Hope. This is good. At least we can keep track of our patients.
Excuse me, Dr. Sophia. I've noticed that very many of our patients under the age of 5 have not completed their immunization.
Where are most of these children? Do you know?
Yes, they are from the villages, others are from outside town, others are from the islands, and many of these cases are from the islands.
When was the last immunization outreach?
I don't know. Mr. Wilberforce is the one who knows.
You innocent, eh? Don't park on the grass, man. Don't even pass on it.
Is Mr. Wilberforce in?
Yes, what do you want? Who is this even? Your wife? Yeah. Innocent's wife. But she looks very old. They must be having problems.
Who is he and where did you find him?
I don't know. I found them on the road.
Will my baby be all right?
Well, madam, I'm sorry to tell you, but I'm afraid it's already too late. Your child is dead.
Can I help her, Mr. Wilberforce?
Oh, come in, Nurse Gertrude. That poor woman has just lost her child.
Oh, poor soul. Oh, it's so hard to lose a little one.
Did you know it had measles?
I suspected it when I saw the rash and the child was convulsing.
This could have been avoided.
Are you saying the child wasn't immunized?
That's what it looks like. Instead of bringing him in here, it seems she took him to a witch doctor. Herbs, grease, defender charm.
Oh dear. I'll take her outside and give her some tea. And then I'll wrap the baby and take it to her to go home.
Hey, close that door. Where exactly did you find her?
I told you, on the road.
Near the witch doctor. Did she see you go in for a consultation?
There was a moment when I was inside.
You should be careful. You know what could happen if anyone else found out about your little problem?
Don't.
Make sure no one else sees you ever.
Do you have any other children? Are they immunized? Then we should bring them in. Let us make them safe, okay?
I better tell my daughter to bring hers as well. Hey.
Good evening, Mr. Wilberforce. I'm so sorry about the child.
Yes, the mother should have brought him in earlier when we had just developed the fever. We could have saved him then, but she delayed.
It is so sad. However, we have to stop this from happening again. It seems from the graphs that the dropout rate is high. We are not meeting our targets. That's why these children are dying. And if we could do something about it.
Yeah, true.
We should follow up on these children. The records show that many children outside town are not completing their immunization schedules.
We have an outreach program for Zenawi village the day after tomorrow.
That is good. We must start up a new program for the islands as well.
That's not easy. They don't like doctors. A superstitious lot.
We cannot let their superstitions stop us. Isn't Mr. Banda LC3 of the islands as well?
Yes, he is.
Good. In that case, take him with you. Those people know him. They respect him. I'll go to Zenawi village with another team.
You want me to go to the islands, doctor? Very well. I shall also need a nurse. Perhaps that young girl, Hope.
Oh, no. We need her on the reception. You can take Nurse Jane with you.
What an excellent idea.
You see, these are my people. The islanders are truly my people. I talk to them and they listen to me.
Then I'm sure we'll not have any problems. Will we, sir?
Believe me, I'll explain the importance of the program. Don't you worry about anything. These people understand me and trust me. These are my people. People! Look!
People of Siguru, my people, we are very, very pleased to be with you. We are here to immunize your children.
Hey, what are you doing? These are doctors from Konoweka. What are you doing?
Mr. Banda, it's you. Hey, you people. It's Mr. Banda, LC3.
Hey, Mr. Banda, you're welcome. Kwacha, it's Mr. Banda wa Mayor.
Everyone, come and hear what our man has to say. Come! Come!
You see what I told you? Come along. Let's go and find a place to put up your stall.
Is he yours?
Yes, madam.
How old is he?
3 years old.
Has he had his immunization shots?
Yes, I told the mother. Now this village is very keen on immunizing the children.
That's good. We won't have to explain much then. We'd better get started.
This is the LC1 chairman. I believe he has the place already set up.
Good morning, sir. Thank you for bringing so many people. It's very impressive. This is good. I hope Jane and Wilberforce are as busy as this on the islands.
My people, immunization is very important and good for your children.
Once they've been given immunization properly, they will not catch measles, tuberculosis, whooping cough, polio, meningitis.
What? You people are here to kill our children, giving them medicine that is old, and you don't want to throw it away.
My friend, that's not true. You can check the dates on the containers. We are professionals.
You people are lying. We shall not allow you to kill our children.
Mpayo, how can you speak to your elders like this?
Dada, these people are lying.
Are you sure? Eh? You remove your shirt.
Ah, wow. Why? Yes.
Are you disobeying me? What is this? Do you know where you got it from? Doctor, is this what you are talking about? Yes. You see, this shows that you are immunized. And here you are alive. Stupid boy.
But doctor, you have not told us about these diseases. Are they serious?
Very serious. If the doses are not completed, a child must finish all their immunizations before the end of their first year, or they can become blind, not walk, or even die.
But are you sure this medicine won't make our children sick?
The medicine is safe. Your children may have a little fever or a swelling at the place we inject, but this is normal. It will go away in a few days.
But tell me, my friends, isn't a little fever that you can cure better than blindness or losing your children?
Yes.
Mom, come. Bring the children.
Mr. Wema.
Yes, Hope?
I had just come to say thank you.
That's okay. I'm glad I was able to be there. It was a bad situation. Men can be dangerous to girls like you. But if you're worried of anything like that happening again, you should talk to Jean or Nurse Gertrude or Dr. Sophia. She doesn't bite.
I will. I had brought you something. I baked them.
Ah, thank you. Thanks. You didn't have to.
I'm really very grateful for everything you did for me.
That's okay. Glad to help. Thanks again.
But all this medicine, isn't it expensive?
No, not at all. You don't have to pay for anything. You'll get them free from any health center or outreach clinic. Good.
Is this her first immunization? It's good you're immunizing her now, but you should have done it straight away when she was born in her first weeks of life.
I didn't know. But then, are they finished?
No. In 6 weeks, she will need the next one. Then 2 more after that. You should come to Corner Wake on this date, okay? We shall also be coming here on the last Thursday of every month.
What about my baby? Do I immunize?
If you deliver the health center, we'll immunize immediately after birth. Otherwise, you should bring in the child during the first week.
The first week?
Yes.
Okay. How will I know when to do the second time?
We will give you an immunization card like this with the dates. You don't worry.
I am most grateful to the man who brought her.
Mr. Innocent, who will tell him? I'm glad you came as well. It's good when husbands take interest in their children's health. It seems this one is developing a fever. Hope, come and help me. The boy has measles. Please give him vitamin A drops and ointment for his eyes.
Okay, sister.
Okay.
Will he be all right?
Oh, yes, definitely. We are going to treat him and we'll immunize this one. Do you have the immunization card for the baby?
No.
Maybe at home. Okay, how old is he?
1 year.
I'm going to give him his measles immunization now to stop him getting sick like his twin brother. While he's here, we shall give him DPT, hip hep, and polio drops, okay? Then make sure you bring him back on these dates. For the rest of his immunizations.
3 times?
Yes, making a total of 5 times. Then your child will be fully protected against the 8 different diseases.
That's very good. Now remember to continue and ask these good doctors everything you want to know. They're here for you.
These are from the villagers to say thank you.
Thank you. Thank you. Now, you take good care of my doctors here. Bring them safely tomorrow.
I'll treat them like the president.
Oh, that's good. Mr. Wilberforce. Jean, I'll see you tomorrow then.
Oh, yes, see you tomorrow.
We are staying?
Are you worried about your fiancé? He can spare you for a night, can't he? Don't worry. I'll take good care of you.
What is it?
I think we have a small problem with the radiator.
The radiator?
Yeah.
Didn't you check it before we came?
I didn't know this would happen.
It's late. We can't stay here.
Don't sleep in the ambulance. There's a bed in the back.
Your ambulance. Mama, not me.
You're not serious. Call the center and tell them to collect us on the motorbike.
Call the center? Doctor, how?
On your phone. Don't you have a phone?
You come and help me with this radio call. Is it the green one or the orange one?
The green one.
Hello? Hello, Konoweka Health Center?
Hello, Konoweka Health Center, over.
This is Dr. Sophia, over.
Konoweka Health Center, Dr. Sophia, I'm getting you. This is Hope, over.
Oh, Hope, the ambulance has broken down. We need you to send someone to collect us on the motorbike, over.
The motorbike is not here, over.
Where is it? Over.
Mr. Wilberforce keeps it at his clinic, but Mr. Wema has got a motorcycle. Can I get him to pick you up, over?
I suppose so. Tell him we are a few kilometers from Zenau village, next to the trading center. Over and out. Thank you so much.
And the night is yours alone. When you're sure you've had too much of this life, hang on. Don't let yourself...
It's a calm night, isn't it?
Mr. Wilberforce, you scared me.
Oh, I'm sorry if I did that. I do not intend to make you scared of me. What were you looking at?
Nothing.
Oh, it's a beautiful view. Were you perhaps thinking about your fiancé? Oh, of course. I bet he's missing you. I know. If you're mine, I would miss you too.
Mr. Wilberforce?
Don't be shy, Jane. I understand your feelings, but he's far away and we are here.
Mr. Wilberforce!
Why be lonely, Jane? Here we are, the two of us, and with nobody to ever know.
Mr. Wilberforce, what are you doing?
Jane, I've been watching you.
Mr. Wilberforce, I don't like what you're saying.
Jane, I know you are lonely without him. I'm here lonely like you. We are both grown-ups. Why not relax and enjoy ourselves?
No, leave me alone.
I am not the one. I can't swim. Oh, I can't swim. Help! Help! I'm drowning. I'm drowning.
Mr. Wilberforce, hold on. Someone help me. Help me.
Help him. Help!
Mr. Wilberforce, hold on to that feet. Hold on. Someone help me. Someone help me. Help me. Hold on.
Your chariot, Madam Doctor?
How are we going to sit on that? It's an accident waiting to happen.
Do you want to go or stay and wait for the bus?
Very well then. Do you have any helmets?
Sorry, not on this trip. You just have to hold on to me for your safety.
You must be joking.
Suit yourself.
Just remember, you have variable passengers.
Passengers?
You expect me to stay here?
That's a full load, okay. Sorry, Bosco. You ready?
Whenever you are, Mr. Weller. I'm happy the immunization outreach program went well. If all villages were like Zenao, we wouldn't have any children dying needlessly of diseases we can prevent. Gertrude says the mother who lost her child to measles brought in her others for a checkup and examination. That was very nice. What was even better was that the father was there. I think fathers should also take an interest in their children's health and not leave it to the mothers only. It's really important they make sure their children complete 5 rounds of immunizations before the child's first birthday to give them complete protection against 8 diseases.
Take me to the center.